Hi everyone, it's Katrina Rossini and Amy Jenkins with BlunTv's Capital Cannabis Corner. We're here talking about all types of interesting topics. We talked about federal updates. We are now talking about an FDA guideline. I know that we've been discussing this, especially in the space of hemp, this last time. If you recall, Amy and I were discussing what all that meant to industry, and there's an update in the space of FDA guidelines that are being created because there are folks who are, I guess, making claims that are inaccurate currently and not allowed, correct? So it's being now enforced.
It's now being enforced. So as you mentioned, we talked a little bit in a prior segment about how the Federal Food and Drug Administration was conducting hearings to develop guidelines around the safe use of cannabidiol or CBD derived from hemp. And so parallel to those conversations and as those guidelines are under discussion, the FDA on Monday issued a warning letter to a Massachusetts-based company, CBD company, for marketing and selling products online with unsubstantiated health claims. So for instance, this company is suggesting, it's Curaleaf, is suggesting that their CBD products cure Parkinson's, reduce opioid use, resolve pet anxiety. Candidly, these are all things that a lot of people believe CBD addresses, but nonetheless, there is no federally sanctioned guidelines around the safe and appropriate use of CBD. So they've issued this warning letter to this particular company, and probably the beginning of other warning letters to come.
So enforcement's kicking in. And so what does that mean to these companies? Does it mean that they have to immediately seize all kinds of claims? Are they going to be pursued legally? What does that usually look like?
Well, this is just a warning letter for now. So we'll ultimately see what the final action is. So what this warning letter says is that Curaleaf has 15 business days to respond, which includes addressing these unsubstantiated claims that suggest there are therapeutic and medicinal benefits. I cannot talk today to their products. Yes, it is a little misty out here. And so they have 15 days to respond to the FDA. So we'll have to see what additional enforcement actions may or may not come as a result of this. But this was a story that I saw in CNN, and a lot of people are talking about it. It was covered by some local commentators here in Sacramento because we know that the CBD market is exploding. And so in the midst of this huge explosion and all these products are coming out online, the FDA is cracking down. So it's going to be interesting to see how things shake out, as you noted, and what the ultimate response will be.
And it's interesting, as Amy mentioned, the CBD products could be purchased, hemp-derived ones, over the counter at different places. And people do believe in this product. I mean, there have been bills, and the vet bill we discussed, and all kinds of different topics wrapped around this. But again, industry, you heard it, you are not allowed to claim anything right now. The FDA is listing out the guidelines and enforcing it. So, well,
and I think it's really important, sorry to interrupt, but I think it's really important to note that we have those current guidelines too on the books here in California, not only for hemp-derived CBD, but even cannabis. We are not lawfully permitted to make these kinds of health claims. And until there's federal action and federally recognized science around the medicinal benefits of either CBD derived from hemp or CBD derived from cannabis, those health claims are unlawful.
And I'm going to ask Amy a quick question about a follow-up on this. Do you think it's going to be a few years before we start seeing some research in the space and how long do you think it might take? I mean, no one's holding, you to this, obviously, but just to get your perspective as an expert in the space, you've been in the space for about a decade now. And so for somebody with the knowledge you have, do you think it's going to be in the next few years that we're going to see, or is it going to be a longer duration?
Well, I think that's a complicated question. Like anything involving cannabis, there's always a complication. What I'll say is the state is beginning to make substantial investments in cannabis research. And there's legislation that we've previously talked about and funding available. Our UC system, our Center for Cannabis Research at Davis and San Diego, there's a lot of efforts underway in California. And there's been legislation at the federal level to really examine, more specifically targeted legislation, but to examine the benefits of cannabis use as it relates to PTSD and other chronic, illnesses that affect veterans. So I think we're beginning to see that. In terms of a timeline, I don't know. One of the last segments we talked about the FDA and that they were suggesting 5 years just to examine and develop guidance around the medicinal benefits of hemp-derived CBD. And what we saw after that timeline was announced was Congress very, very quickly reacting and saying, no, you need to do this much faster.
Yeah.
So I think there's a real push for a more expedited review, hopefully a lot shorter than 5 years' time. And I think that's probably going to be reasonable given all the immense pressure that's being placed on the federal government and on the state to really start, developing and recognizing what these products can actually do for consumers.
And as we see more states legalize, even on the medicinal side, not necessarily even the recreational side, it seems like it's just moving faster and faster on a daily basis. And you heard it first from Amy herself that this is a space that we're going to keep looking closely at. So a lot of people are looking at what are the benefits. The confusion around it is what's possibly hindering the space when it comes to investments, when it comes to folks who actually are curious about it but don't want to try it out of fear. There's so much to it, and the stigmas as well. So we'll keep covering this with Amy, and stay tuned, and thanks for the ads and follows with BlunTV.